Hello and welcome back to the Modern Pain Physician. I'm your host, Dr. Kent, and today we're going to be talking about treatment for spondylosis. So when we talk about spondylosis, there are several parts of the spine that we're talking about. For this particular video, I'm going to hone in on the facet joints. And so again, that's that pain that's right along the spine and right along the kind of the neck, mid-back, low back that doesn't go down the arms or legs. So treatment for the facet joints typically revolves around injections or something called a radiofrequency ablation, or RFA. Sometimes you'll hear it described as a medial branch neurotomy. All of those are basically talking about the same thing. And so a facet joint injection is what it sounds like. You inject something into the joint, and the goal of that is to try to relieve inflammation of the joint. And so it's typically injected with something like local anesthetic, which numbs up the joint and can provide some diagnostic or kind of a test, if you will, because it'll tell us, is the pain coming from that joint? And then the steroid essentially provides an anti-inflammatory into the joint. And so that's when people talk about injections in the facet joints, that's usually what they're talking about. You can inject other things into the facet joints. And so, one of the newer therapies are things like PRP, or platelet-rich plasma, which is essentially, spitting down your blood and injecting in kind of the anti-inflammatory and regenerative molecules in your blood into the joint to help heal and reduce inflammation. And so that is something you may hear about. The other thing you may hear about is things like stem cells. And so that's kind of heading down a rabbit trail that we're not gonna go through right now, but there are several things that can be injected into the joint. The other part of that is what we talked about is the radiofrequency ablation. And so essentially what you're doing with that procedure is you're interrupting the pain pathway, so your brain just doesn't sense pain from that joint. Before you head down that treatment modality, you'll end up doing what's called a medial branch block, or a nerve block essentially. And what that is doing is you numb up with local anesthetic just the nerve, and then the patient ends up doing a pain diary to see, is the pain coming from those joints or not. That test you're only basically testing the joints that you inject. And so there are several joints in the neck, mid-back, low back. And so if you have one of these procedures done, the goal is just only testing those particular joints to see, is the pain coming from those joints or not. If you have a positive response, which in general, insurance essentially says you have to have greater than 80% response for the duration of the numbing medicine, then what happens is you do a second confirmatory test. It's the exact same thing. The goals is the exact same. And so basically it's confirming that is where the problem's coming from. And if with both of those two tests, you get basically a fantastic response, greater than 80% relief, we usually ask about functional improvements. Are you able to walk longer, do certain activities with less pain? Then you proceed on to the radiofrequency ablation or neurotomy. And that procedure is essentially the same thing as far as the target where the procedure is done, along the medial branch nerve to the joint. But the difference is you numb up the nerve, and then you burn it. The burning essentially creates a segment of that nerve that no longer functions. And so what that does over time is as your body heals up after that procedure, that nerve isn't able to send signals as efficiently, or is not able to send signals at all. And what it does is it makes it so you just don't feel pain from those joints for a period of time. And that procedure is not permanent. And so generally we say 80% of people will last in between 6 and 18 months. Eventually that nerve does regenerate, and then you can go ahead and have the procedure done again without doing all the tests. And so those are going to be our main treatment modalities for basically facet arthropathy, or arthritis of the spine. There is no surgical option. I want to drive that home. For facet arthropathy, there isn't a surgery that can fix the problem. The treatment is injections, radiofrequency ablation. That's, in addition to things like physical therapy, chiropractic care, acupuncture, those are going to be your other kind of non-intervention modalities. But there is no surgery for basically arthritis of the spine. Haven't figured out a way to replace the spine yet, and so the only treatments we have is just to interrupt the pathway between the joints and the brain. There are some nuances with radiofrequency ablation and facet joint injections. When you talk with your provider, they may talk about doing one versus the other. Oftentimes, this has to do with insurance. Medicare has essentially gone towards radiofrequency ablation as the sole way to treat these arthritic joints. And the rationale behind that is it's more of a predictive and more long-lasting treatment as opposed to injecting steroid or something else into that joint. And so what you're offered your insurance may dictate what you're offered, but that's the treatment for spondylosis. Take a look at my other videos. We're going to be talking about other areas of the spine as well as treatment of those areas. And so thanks again. Have a good day.